Welcome back to the Environmental Health Profession Series podcast, where we highlight people and the professions protecting public health around the globe. I'm your host, Jeff Mooney, Program Director of the Bachelor of Science in Environmental Health at Old Dominion University, and I'm especially excited to welcome today's guest, joining us all the way from Iwakuni, Japan, Lieutenant Russ Ongkeko. He's an environmental health officer in the United States Navy and is currently serving as a department head for public health at the Navy Medical Readiness and Training Unit, Iwakuni. What makes today's conversation especially meaningful for me is that Russ is one of our own. He's a proud graduate of the Joint University and Eastern Virginia Medical School in the Masters of Public Health and Global Environmental Health program, where he was inducted into the Delta Omega Honorary Society in Public Health. Russ, first, thank you for making the time to join us all the way from Japan. Before we get started into your Navy career and your operational public health work, I'd like to start with your story. Tell us a little bit about yourself, your current role in Iwakuni, and your path led you into environmental health.
Hey, Jeff, thank you very much for having me. Yes, currently I am the department head for public health here at the clinic here that we support Marine Corps Air Station Iwakuni. This field holds a very special place in my heart. This has led me to really expand my horizon and provided me the opportunity to care for a larger population. This opportunity gave me some very good experiences to care for not just the military population, but also the dependent population.
You're having your own little town that you're responsible for all the public health needs and specifically in environmental health. What sparked your interest in environmental health?
I started actually my military career as a hospital corpsman. I had the Navy enlisted classification code laboratory technician when I first joined, and I was fortunate and privileged to have been a part of a team that supported Operation United Assistance, which was the Navy's response to the Ebola outbreak during the 2014-2015 outbreak there in Africa, in West Africa. And as a laboratory technician, I was exposed to the challenges that specifically Liberia had in terms of public health. And that sparked my interest. And that was my turning point that I said, I am going to be that person. I want to be a link to making sure that some public health infrastructures, wherever I was, to make things happen and make the public health infrastructure stronger.
How did you even find out that you could serve in environmental health, public health specifically, and continue doing that in the Navy? It's very unique in a sense of trying to find that pathway while you're in, but also like many of us really didn't know what that was at the time, especially in the initial parts of our growth.
That's true. I was fortunate enough that when I was in a command called the Navy Environmental and Preventive Medicine Unit 2 in Norfolk, Virginia, where it was a command where multiple disciplines of public health are there. And a lot of the personnel there were environmental health officers.
Mm-hmm.
And that was a privilege to always have a chat with them, what their contributions are to the community. One of my mentors, Lieutenant Commander Chris John, was chatting with me one day, and I really took me under his wing and provided me some guidance and told me how impactful I can be if I join the community.
Describe your educational background. How'd you pursue it? What made you choose coming back here at ODU and as a pathway? I know Christian for quite some time. He's one of he's in the past, and now he's assistant special leader. It's good to see that passing the baton on there.
Yeah. My undergrad was actually in business administration, business management and entrepreneurship that I earned when I was in the Philippines. When I joined the military, I didn't really know what pathway or how I'm going to be utilizing that degree when I enlisted. And given my experiences and the people that I met, I learned about environmental health. When I was in Norfolk, I pursued that because I have talked to the Navy recruiter that this is a pathway that I can take. One, I can transition from being in the enlisted ranks, going to the officer ranks, and at the same time fulfilling that need or that urge for me to serve on a population level. I've applied for the global environmental health track with that joint program with Oldham University and Eastern Virginia Medical School, and earned my master in public health concentration in global environmental health.
Yeah, that was and there's classes you had to take here. I know a lot of the faculty are still here that you've had connections with. That put you in a place where you could qualify to become an environmental health officer, right? And then you
That's right.
applied.
The biggest factor there is the accreditation. I wouldn't have, with me being in the area already in Norfolk and having like easy access to the universities, it was almost like super easy. It made it very easy for me to transition and take classes in that joint program. And the staff was very accommodating, very military friendly, and provided me an opportunity to really put forth my full potential as a student, as an active member of the community in Norfolk and Virginia Beach and the greater Hampton Roads area.
Yes, for those that are unfamiliar with the field, what does an environmental health officer do?
For us, the environmental health officers in the Navy, what we do is we identify health risks before it becomes problems for the community. This field is very vast. We deal with food safety, drinking water, communicable diseases, and such a very diverse field that touches almost every part of life. And we, as environmental health officers in a community that we serve, we identify those risks. And if there are risks that needs to be, made known or mitigate, then we make those recommendations to the commander of the installation that we are serving.
Those are day-to-day challenges. Are there misconceptions that people have or within the organization about environmental health?
Yes, I think I would say the biggest or the most frequent thing that I encounter is that I'm an environmental health officer, and they say,
What
"What
does that
is
mean?
that?" I'm not sure what that. Really, tell me what that means. I put it in a nutshell as if there are risks in the community, we identify those, we tell you how to prevent or minimize those risks. These people in the community don't get sick.
Yeah, can you tell me you were part of the COVID-19 USS Theodore response, and not many EHOs get to do sea tours, right? That's you had your experience with the team. Can you tell me what that experience was like and what some of the tasks you were assigned to do?
Yes, that was a very rewarding experience. In my enlisted time, I served at an aircraft carrier already, the CVN-77 George H.W. Bush. And coming back to another carrier in a different capacity in a field that I really love doing was really a blessing. I was able to experience applying the public health mitigation measures that I've learned in school, as because during that time that was my first duty station at 2 in Norfolk when I got called upon supporting that mission. It was having that confined spaces in that kind of setting puts people at a higher risk, as you know, because because COVID is like respiratory issue. It's very difficult to maintain the public health measures that you're trying to do, especially because of working in very close quarters. It really was a very rewarding experience. The challenge was having in mind the idea or the spirit of what you're trying to mitigate, and at the same time keeping in mind the operational mission that you have to meet. The balance of that could be difficult at times, but we made it happen. I was a part in my team was also a preventive medicine physician, 2 preventive medicine techs, laboratory microbiologist, and some lab techs. The team really put together a good product in terms of laboratory testing and public health measures. So that was a very good experience.
Yeah, I think the biggest piece to that as the sustainability of operations once we identified the disease and countermeasures and being able to conduct testing and being able to, as they continue to sail on, being able to get risk communicators, being able to identify what the current risks are, how to mitigate, control with the uniqueness of a U.S. Navy warship, which is not like a cruise ship, right? So all those confined spaces are truly confined. That's a very big challenge, and that's why those teams were essential to ensure that leaders are having some more risk measures and balance to what was going on during that time. And it was definitely my own experiences because I was initially part of the Guam and the initial Theodore Roosevelt response. That was pretty interesting times. You know, that kind of leads to like what makes environmental health unique profession within Navy medicine.
I think I alluded to this earlier. The diversity of the fields that is just expansive. We touch, as I said, every single thing that everyone touches it, on a day-to-day, with food, with water, with sanitation. I think for us, having that kind of diverse background puts us in the military in a very good position because we are communicators of risks and we are in direct link with the commander, and we can influence the trajectory of the completion of the mission if we do our job correctly. And that turns into making sure, as you said before, is our job as environmental health officers is to build bridges. And that connection with all of the different stakeholders, I think, is important to have that groupthink and multi-agency collaboration to make the mission successful.
Right. You can't solve problems by yourself. You need a multidisciplinary approach, and your skill sets as an environmental health officer are able to pull all those assets together. So your foundational sciences, your laboratory sciences, and your experiences in that, and your educational really put you in a space to be really a jack of all trades, a master of none. But I always say, for a jack of all trades, a master is a lot of different things. That's a big piece of it. That's one of that goes back to the question about the uniqueness. Is that it sounds like our jobs are different every day, right?
Yes, it's never a dull moment in preventive medicine or in public health because that's what the exciting part of the job is. One day you are doing some. Sorry.
That's all right. That's your day in the business.
That's right.
Hospital there.
That's right. I think the excitement comes from like one day you're doing a food inspection, you do your report, you provide recommendations for all of the hits, and then the next thing you know, there's a person getting bit by a rabid cat, and you have to provide recommendations for that. And then next day, you have a diarrhea episode on the pool. It's definitely very exciting. You have to have like you can't. I don't know about you, but me, I don't have all of our instructions and memorized in my head. And the key thing is knowing where to find the most recent instruction and the most recent guidance for these things that pop up. As you know, like science is always evolving. There's new data out there. So having that mentality of knowing where to get the latest information is your best bet.
Yeah, you have to stay on top of your whether it's news or it's reporting, public health incidents, CCMMWR reports, especially as the emerging diseases or re-emerging diseases are there. You really have to be on your game. There's one of those kind of professions where you can't just say, "Hey, I don't know that answer to that question." let me get back to you. You're really on the spot, right? You have to be generous, would say,
That's
as
great.
you go. So it can be daunting to be able to have to be able to gather all that information and be able to retain, but also really it's just knowing your resources, pick up a phone call. So you've now established, I'm sure, a pretty large Rolodex of confidants that you can rely on and ask those questions. And I'm sure they use you as well as a consultant to some of their problems, even though some of these things not be related to environmental health whatsoever, but they just think, well, you guys solve problems all the time, so we must reach out to you.
Yes, that's true. And your last point there of this is not even a environmental health officer realm, but with the Rolodex, as you said, that you've built and the bridges that you've made connections, you can easily provide them the information, and you become a true asset to the command.
How was your career evolved from your first tour to your current position? You've been an EHO for how long now?
About 7 years, oh yeah, almost 7 years now. And from my first duty station at NetView 2, I that was during the time that COVID hit. I was really exposed to a lot of challenges with public health, and everything. Everyone is looking at public health field because we are in the limelight. That was our spot. There's no other way to start your career but to start with
By
and then
five. Oh yeah,
that,
absolutely.
it's a good thing. But it was fortunate to have that experience. I think that was a very good foundation because in NEPME 2 it was a multidisciplinary command where you have all sorts of subject matter experts there. The best people that I've leaned on during that time was our preventive medicine physicians, along with the senior environmental health officers there, and have taught me the ropes, given me pointers on how to be an effective environmental health officer. From there, that's where I deployed to the USS Theodore Roosevelt, learned a lot of experiences there. And then transitioning after my command, I went to the 1st Marine Aircraft Wing in Okinawa, Japan, where I served as a Force Health Protection Officer. Being at that
What's that role do? I
level
mean, what's the responsibility of a force self protection officer for a Marine aircraft wing?
during that time with the Marine Aircraft Wing at that level, we take care of the different groups, called MAGs or Marine Air Group from Okinawa and Hawaii. And as a Force Health Protection Officer, with all those groups, exercises, and missions, as a Force Health Protection Officer, you provide them with the current guidance, provide them Force Health Protection briefs and the certain or specific locations that they go to, what are the risks, what they should do, what type of prophylaxis they need prior to leaving, what are the things that they need to do while in country to protect themselves and allow them to meet the mission without getting sick.
Well, what are some crazy bugs or things that would concern in those parts of Japan, especially as they're operating? I'm sure you're pretty busy, but what are those concerns that are brought up all the time?
I think that the communicable diseases would be the most. Another thing is the ensuring that they maintain proper sanitation in their
Like field,
location,
yeah, field
in
environments
the
that
field
they're working in.
environment.
What
Also,
does that entail? Like you're talking about sanitation. You think that they should have access to clean drinking water and habitable areas to ensure that it's not filthy, and then of course the environment, the bugs and diseases associated with vectors. Why would that necessitate the need for a person like you?
yes, for those types of environment, in austere environments, there are a lot of health risks that they can encounter. You have mentioned vector. They have to make sure that they're in a location where they have to make sure that all of the tools that is provided to prevent them from having some sort of disease that's caused by being bit by a mosquito, say Japanese encephalitis. All of the kits, as far as like using their uniform, not leaving or PTing during the dark, taking their medications. It's not a one answer to everything. You have to make sure that all of those are being adhered to. That is one. And then also the ensuring that the heads or the latrines are in a bathrooms
Yeah.
are in that they have fashioned has the right amount of distance from their birthing areas or from food facilities, those kinds of things.
That's a part of like field sanitation. We just as you met, if anyone listening is like your audience, it's part of that. There's that hardened building and structures and plumbing that you're doing sanitation in a field expedient way. And when you don't have all these accoutrements of the niceties of plumbing, disinfected water, things can go pretty bad pretty quickly with the effectiveness of a population. Was there any concerns of vector diseases that were in that particular area? And you mentioned prophylaxis. That means getting shots and vaccinations to prevent them from certain diseases. But what were some diseases of concern for that area?
Well, we have, but prior to deploying, we have the military is very good at identifying those risks already, given the environmental health officers and public health subject matter experts that served before us. They were able to generate a list of things that you need to have, like as far as the vaccines. Those are in place to ensure that these diseases don't happen. It's not a whole lot of diseases are being acquired because of those measures. One of the diseases, like I said, is Japanese encephalitis.
And what is that?
Japanese encephalitis is a disease that is caused by a vector mosquito. When you get infected, there's an inflammation of the spinal cord, and you get really sick.
You're getting vaccines for that because of the mosquitoes and the vectors, particular mosquito species that carries that. You have to be vaccinated for that. Right? It's important for your military readiness to continue your exercising, whatever mission you're doing. That's yes. You have this health threat history, but one of the biggest pieces that even though you may have that data from people that before you, I think one of the interesting things is that people still do dumb things. You always have a job where because of just the human nature in itself, that getting in their hands dirty and they're playing in probably some fecal infested waterways. There's always the concern of that kind of things out there. So your job's pretty busy there. That skill might relate to other things that you might find yourself in. Have you done roles in humanitarian assistance and disaster response operations?
Yes, unfortunately, I haven't had a chance to do any type of humanitarian assistance. As a matter of fact, I chose NEPMU 2 as my first duty station because I know that they do missions with the USNH Comfort,
Right.
and that's what I was hoping to do hoping to be a
you
part of during that time. But
you got on a gray hull instead.
That's right.
A global humanitarian response.
That's right. But nevertheless, I'm still looking forward to something that is that involves that. However, here in my role as a public health emergency officer for the installation, we partner with our Japanese self-defense force partners. For the second year in a row, we have participated in this exercise called Nankai Rescue, where we exercise the response of our installation if the Nankai Trough has an earthquake. It's a very big Japan self-defense force exercise that they do on an annual basis. And with us having participated 2 years in a row now, we're continuing to build that capability and strengthening our partners' relationships.
Yeah, that's a very coordinated effort because most of your disaster injuries in a highly tectonic area of Japan, where it's volcanic activity or tsunamis, Those are crushing injuries. And then that affects what else? Your municipal systems. Without coordination with the public health authorities and that collaboration, that disaster response is critical, because that's when people's powers go out. That's when plumbing systems are broken. Then distribution of all of the things. Those folks are, as environmental health officers, and your collaboration with Japan Defense Force, that is an important piece to stay connected with. That's real life things that happen as you going through your career. Those experiences that most people would never get, right? That are not, especially if they never join the military or they're doing public health, but they don't get to experience the global nature of all the things in environmental health we get to do. It goes back to your day is always different, whether you're working with that collaboration, that prophylaxis, that assessments of health threats, but you're also doing the very tactical things. And you as a leader, as a program manager, and as a department head, department head is a term for being you're a division chief, or you're the head of an organization to support your particular skill sets in preventive medicine. Currently in your space right now, what does a typical week look like for you in your responsibilities as a department head for preventive medicine?
Right. For now, a typical week during this time, summer, we do surveillance. We're part of that. We provide that capability to the base to ensure that we collect the mosquitoes and send them to camp entomologists that we partner with to make sure that those mosquito species and count them and ensure that they don't pose a threat. Also, with summer, the pools are open. We do pool inspections, routine inspections with our food facilities, habitability inspections for our barracks and housing units. Also, in preparation for the flu season that's coming up, we're ramping up that touching point on all of our partners that will be involved in the preparation for the mass flu vaccine event. Also, during this time, we are also preparing for an annual exercise that the installation is a part of. That's again working with.
As part of your disaster response efforts for a major event. Yeah. How do you balance your technical expertise and your leadership responsibilities?
That's a very good question. Yeah. It's tough. It's not walk in the park, to say the least, because those things that we routinely do as a public health department, and juggling that with understanding your personnel, making sure that these personnel that you lead to maintain these very demanding programs of public health, preventive medicine and immunization, safety and industrial hygiene, that they on top of their game at all times, ensuring that your personnel's career progression is providing them mentorship and giving them the tools that I had learned in the past is important. Every time I get a chance to sit someone in my office to see how they're doing, to make sure that they are on track with their long-term goals, with their short-term goals, I do that. Regardless of how busy we are as leaders, it's important that you take that time to invest in the people that you lead.
As you're gaining experience, and you're also learning through experiential learning, as well as growing in your own technical expertise. If someone's listening outside here, wanting maybe to possibly do this or coming into the profession, what skills are most important for success as an environmental health officer?
I would say the most important skill for you to be successful as an environmental health officer is the skill of connecting with people, knowing where people are at and how they perceive things. You have to have the ability to unlock or discover what is happening or what perception the other person across from you is thinking, and how you are able to use and understand that perspective, you are able to mesh what your goal is to their perspective. Because at the end of the day, the person that you are talking to also has the goal of making people safe, making the community safe. No one gets up in the morning and say, I'm not going to do good today. It's inherent for every person to do good. And for you as a good communicator, you need to make sure that you put yourself in their shoes and understand where they're coming from. Each of you can go to the same goal, which is protecting the community.
Hey, Russ, I want you to repeat that, the most important part of growing and skill sets. Can you say that again, please? At least your concept of it all, because it's a very resounding concept in public health.
I'd say the most important piece is understanding how the other person that you're speaking to, where they're coming from, and knowing how they perceive things in order for you to provide your feedback as well and how you perceive things. You can get to that common goal.
Yeah, we're in the people business.
We totally are. Yeah.
Yeah, creating relationships. I always say the P in public health stands for people or politics.
Yeah.
It's the same. Being able to create those connections, because that's one of the challenges in public health, especially in our field in environmental health, where we're the scientific sleuthers, the cradle to grave, the CSI of public health, investigating from an agent through people, through the environment and the outcomes, and then providing countermeasures. Without those connections and trust and being able to communicate, it's a challenge. I'm not saying it's perfect, because we're all learning how to communicate and find what's more effective. And as we are very global in the communities, you're having to be able to understand how people receive, how information is given. It's a very good point that you made, and I appreciate you saying that.
Yeah, you're right. I mean, it's the thing that you had told me before resounded in me, and I've always kept it in my noggin, is that, and I've always shared this with the people that I mentor also, is that us in public health, we build bridges.
That's right. That's right. Can you tell me what your proudest accomplishment since you've been in for 7 years in the HO now?
I would say my biggest accomplishment is that I was able to provide and mentor the people that I work with and pass on the little bit of knowledge that I have, and paying it forward in order for the community, for public health to expand more and make it a little bit better, putting that nuggets of information and the experiences that I've learned to all of the people that I have worked with. I think that is what I am most proud of.
Russ, you got to train our replacements, right? Because the future of environmental health, whether you're in the Navy, in the public health, and civilian in the health departments, or in industry, but that future with all the misinformation, all those re-emerging diseases that we're experiencing now, this really drives to, we must maintain the North Star and continuing on and sharing and collaborating, because this is a team sport. The question I have is future of environmental health. What emerging environmental health challenges should the future professionals be paying attention to right now?
Wow, that's a hard-hitting question. Let's see.
It's just really, as we experience now here, even back on the mainland, with measles becoming about, and the anti-sentiment of vaccinations, there is continued challenges. And your experience in Japan, that culture is much different than you experience in the U.S. Commune culture of respect, and everyone is in the communities as part of that. Here, we're still experiencing some of that misinformation, disinformation, and it's really important to, as healthcare providers and professionals, even I would tell my students today that you're going to be out in the challenge to deal with information and the people. Whether, again, it goes back to the P in public health is politics, and you have to be able to always rely in the skill sets that the past generation is passing on to you, because it really comes down to communication and trust. As you will look at future emerging things, like, yes, information is still part of that. We had the experience in COVID, which used to be considered the 100-year pandemics, plague, Spanish flu, COVID-19. And yet here we are. Are we prepared for the next one? And it's not 100 years from now. It could be next year, 5 years. We have to be always on our game, because all the lessons learned from COVID is probably not going to be the same, or we're going to continue to repeat those same behaviors. That really ties to this medium. That's why I have this. It's a medium for me, and to communicate with my friends like you, Russ, that we shared our experiences together, but also how are we able to continue communicating, because technology is changing, communication of technology is changing, and it affects environmental health professionals. Have you seen any of those concerns or challenges, or AI, or even that's of concern for many people? What do you think about that?
Yeah, you're right. There's a lot of things that you had mentioned that's worth noting. The challenges that you mentioned about misinformation and the processes in place to protect the community is slowly being challenged, and the legitimacy of the good that it does. I'm happy that really there's still a good fight that public health professionals are doing with these exception to policies are that are being released now. It gives me hope that there is still the public health professionals out there still has a long ways. Exactly. We have seen multiple instances where without those measures, that the protection that public health professionals or the have laid down is being broken down. It's really up to us, up to the community to speak louder, and also again reiterate the necessity of these programs, of these procedures in place to protect the public.
It sounds like, oh man, why would I want to get involved in this kind of work, right? But the reward is great, and the impact is wide ranging. It's in public health or environmental health. We protect populations, not necessarily just the patient itself. It's the populations of patients. They don't become patients. It sounds scary. It sounds like there is the other forces, external forces, that are causing challenges every day. But rest assured, every public health environmental professional across the globe is working behind the scenes. We've always been behind the scenes type of work. It really goes back to like students or second careerists that may be watching this, not entertaining or enticing. What advice would you give to a high school student or second careerist considering or even thinking about environmental health discipline? Would you tell yourself, oh, you know what, don't do this?
No, absolutely not. I think public health is such a very rewarding field. I never thought that I really wanted until I got exposed to it. What I would say is that if you have the passion to help people and ensure that each and every person in your community stays healthy and can enjoy life as they should, because that's a right for you to have, and to have a good life, to enjoy your life. And if you have that passion, public health is the field for you. It's a very exciting and rewarding field. This is not, as you said, Jeff, it is not something that you are only taking care of one person at a time. The impact is huge. It's wide ranging, and you take care of populations, and the influence of that is just remarkable.
We talked about training our replacements, and now as you're a senior lieutenant, it rises pretty fast about how influential you are in your community. If you were looking for some candidates into the EHO community, which we're small, right? At 100 and something, it's across the Navy and Marine Corps. What qualities do you look for in a young professional pursuing environmental health as an MSc or just entering the field in environmental health? What are those qualities would you look for?
I'll say the good qualities for good candidates would be that you are genuine with the passion that of helping people, and you are diligent with your work. A person with good critical thinking skills is a must because you need to be able to think ahead those risks that could be looming in the horizon. You have to be able to think 2, 3, 4, 5 steps ahead to make sure that you have all the blankets in place to ensure that no issue passes through a Swiss cheese model. Redundancies in your system is important. Also, just to be able to have the ability to connect with people is very important as well. Having that personable and easy to talk to person, and you also have to be understanding and respectful of all the fields, of all of the stakeholders' positions in your circle of stakeholders is very important. Having the ability also to communicate and work and plan with different agencies and not operating and planning in a vacuum. Silos are never good in public health. You have to branch out and get other people's perspective.
Goes back to the people discipline. The concept is that that relationships, because again, we're all solutionists. We all want to solve the problems, but your job is not to just jump on the grenade by yourself. You have to be able to support that with other stakeholders and other expertise that are more experts than you are, but you have some understanding of their specialties, not the professional side of it, but you have I can make the connections to be able to. Sometimes you're the ones on the town hall speaking. Have you had one of those experiences yet?
Not yet. That's
You will.
that will be
In your career, will. I'll be prepared for it. It's a learning lesson, but but you have the tool sets to be able to be prepared for. Really, this is just really at the end of our profession series podcast. I'm going to just ask you some rapid fire questions, and we'll close it out with some things for the audience. All right, you're ready. Okay, most underrated environmental health topic. What's that?
Rabies.
Yes, rabies. Have you had any rabies cases in Japan?
Actually, no. Well, we're very fortunate here that Japan is very low risk here. But again, with the military population here, there's still risks.
Yeah. Rabies endemic into the animals there in the area?
No, not really.
Okay. It's like quarantine, like Hawaii is very strict on that kind of things too, right? Rabies is a 99.9% fatal. That's probably a test question on a communicable disease. Favorite duty station?
Japan, Okinawa.
Yeah, I bet. I'm trying to go back. I'm trying to take my family back to Tokyo. It's like, we got to go to Tokyo maybe in the wintertime. It's like Christmas. And then we have our fried chicken baskets from KFC.
That's right.
Right. Coffee or energy drinks during the inspection?
Coffee.
Yeah. Are you a drip coffee drinker, or you're very fancy like me with the cappuccinos and I'm an espresso behind me? So my milk froth, it's very fancy, bougie here. That's what the kids say. That's one piece of gear you never travel without.
Flashlight.
Yeah. And you got to have your phone as well, but you want that high power. Yeah, high power flashlight. Now that I'm older, I have to use it to read menus. Yeah. One word that describes environmental health.
Bridge.
Okay. Don't blow up the bridge. If you could go back and talk to yourself on your first day in the Navy as an environmental health officer, what would you say?
Open your ears. Listen.
Yeah. Listen. Don't hear. Listen. When you're in the person that the people are looking towards to help solve the problem, you still got to listen. You understand it, right? That's very good. That's a great one. In closing, this is really for the audience and being able to continue to engage them and be able to entice them. Really, and it's really the idea of this whole podcast series is to educate because nobody knows what we do. Be able to open it up to them. What would you want the listeners to remember about environmental health, specifically in the Navy?
I would say what I would like to impart being an environmental health officer in the Navy is that it is such a rewarding occupation because it provides you the rewarding experience of caring for people, and not in a individual way, but on a population-based, widespread way. Understanding that your recommendations and influence can play a big part in the success of a mission for whatever command you're in. If you're in a clinic or at a hospital or an operational command that's in an operation that has national implications, having that privilege and responsibility is such a huge deal. And that is why I think all environmental health officers take pride in the work that they do.
Absolutely. Russ, I appreciate you spending some time with me. I know you were trying to get up early and being able to do that. And you're here you are in the future, 13 hours ahead. Thank you for joining me and being part of our podcast series. It's very helpful, and I hope it was informative to the public. Is there anything we did not cover that you'd like to share with the audience?
No, I want to thank you for allowing me to be in this platform and providing some insights. It's such a privilege to be in this interview, this podcast, and I appreciate you allowing me to share my experiences and my thoughts with your audience.
Thank you, Russ. I appreciate you. And for the rest of the audience, hey, this is the Environmental Health Podcast series. I want to thank Russ for joining me today, being able to spare his time. He's a very, very busy person. He's got many programs he's running and the people he supports. Thank you, Russ, for taking the time to be able to communicate with us and share your stories. And it's a privilege to continue our friendship and our conversations we have. And again, keep in touch. We want to hear from you. And I'm going to share your experiences and your talk with the rest of the faculty here because they remember you, because we still talk about you all the time as well. Take care, Russ. Get back to work now, right? Your day
That's
is
right.
just starting. My day is just ending. Take care, buddy. Thanks, man.